Good morning, everybody. Scott Maybor here, out on the beach in Winthrop. Apologize for the sunglasses. It's just bright out here. Absolutely beautiful. Wanted to follow up on yesterday's post about Part D. I mentioned a gentleman who is having some trouble with his Part D. One, he used the wrong card. So he used his old card February 2nd or 3rd. When his new plan kicked in February 1st, but he also didn't give me all of his drugs. You know, he gave me the 2 that he takes every day, but the 3rd that he only takes sometimes that he happened to need filled at the beginning of February, he didn't bother mentioning. So now the question is, to what extent is it covered? What tier is it? All this nonsense that we could have avoided had he just mentioned that he takes 3 prescriptions, not 2, would have been a lot better. Pretty much everybody who's over 65 and on Medicare is going to take, I should say everybody on Medicare will most of us will have a Part D plan in one form or another. You have to have prescription drug coverage or you get penalized for not having it. So if you're a vet, you could get it from the VA and that would meet it. If you're on Mass Health, you could get prescription coverage through that. But one way or another, you all need drug plans. If you don't have a drug plan, the penalty is 12% a year times the national average, which is about $32 a month. And that is assessed on a monthly basis for every month you didn't have Part D. And once it's assessed, it can never be removed unless you qualify for Mass Health or Medicaid. So keep that in mind. You basically have to have it, even though it's optional, or you get penalized for not having it. The problem with Part D, and don't blame me, I'm just the messenger, call your congressperson, your drugs will change potentially throughout the course of the year. Drug costs can change. Things go off patent and then generics come out. They can change tiers. All of that is out of your control. And unfortunately, you can't change drug plans outside of open enrollment. So all you can do is your best before you enroll. And if you're somebody on traditional Medicare with a Medigap plan, you have a standalone drug plan that you have from October to December to change for January 1st. If you're on an Advantage plan, the drug plan's usually built in, but it's still considered a drug plan. It's still Part D coverage. And you have October to December, but you also have January to March. Or January to April, actually. So if you're on an Advantage plan, now is the time to be looking to confirm that your drug plan within the Advantage plan is still the best coverage for what you take currently. I can't predict the future, but we can certainly make sure that you're not overpaying for medications for anything you're taking currently. Make sure you're going to the cheapest pharmacy for you. I see a lot of people going to the wrong pharmacy. And sometimes it's a personal choice. They want to support the local independent. But a lot of times it's simply, CVS and Walgreens are across the street from each other. It's a matter of taking a right or a left. And if you're taking the wrong turn, you're paying too much. It's that simple. So do I love Part D drug plans? No, because I don't like the fact that they can change on you and you have no right to change on them. But I don't make the rules. But if you want to assess your drug plan and make sure it's still the best plan, most cost effective for the medications you're taking, give me a call. There's no charge. It's quick, it's easy. I need a list of all of your prescriptions, even if you don't fill them on a regular basis. I need to know your dosage and I need to know your zip code. With those pieces of information, I can tell you what the cheapest drug plan is. We can compare it to what you have and see if there is a better plan for you. I'm happy to help. Just reach out. Thank you very much, everybody. Have a great day. Stay safe, stay warm, although it's nice out, and stay healthy. Talk to you soon.